Okay, whenever you're ready.
All right, let me go ahead and share my screen. Hi, everyone. I'm Ashwini. I'm a first year MD MPH student. And my project is about obesity and cardiovascular risk among South Asian Americans. And I worked on this with Dr. Shah and Dr. Kandula of Northwestern University. So just to give you some background, there are really high rates of metabolic syndrome in South Asian populations, specifically in the United States, so immigrant South Asian populations. And metabolic syndrome is a cluster of risk factors for cardiovascular disease and diabetes. And the symptoms of metabolic syndrome include abdominal obesity, high blood pressure, high triglycerides, low HDL, and a high fasting blood glucose. So in general, South Asians in the US experience higher metabolic risk for cardiovascular disease at lower BMIs than other ethnic groups. And because there are not targeted BMI cutoffs for South Asian populations, we often underestimate cardiovascular disease risk because we're going off of the standard BMI cutoffs used for Caucasian populations. So in this review, I wanted to better understand the roles of body composition and obesity in cardiovascular disease risk in South Asian Americans and make a more targeted and unique definition that allows for better screening and prevention of disease in South Asian populations. So for this, I conducted a systematic review. And these are some of the findings that I saw upon this review. So to begin, body composition is vastly different in South Asian populations versus in other ethnic groups. So on the left here, in the general population, most individuals have about 80% of their body weight, of their body fat as subcutaneous fat, which is fat underneath the skin. Versus 10% or less than 10% being visceral fat and ectopic fat being less than 10% as well. So visceral and ectopic fat are usually very small stores of fat in ethnic groups. But if you look at the South Asian population, regularly the visceral fat, so this component here, is a lot larger. And oftentimes our measurements of BMI don't account for larger amounts of visceral fat, which can be around in the abdominal region, sometimes in the arms, which is a lot more common in the South Asian population. So it's important to understand differences in body composition to start off. So knowing this and knowing some of the differences in terms of cardiovascular disease risk in South Asian Americans, a lot of papers that I reviewed suggested adapting current risk assessments to make sure that they were more equitable and more comprehensive in terms of understanding South Asian body composition and fat distribution. So first, right now, we usually use BMI thresholds, where a BMI of 25 to 30 is considered overweight versus a BMI of above 30 is considered obese. And there have been a lot of issues, understandably, with BMI being so heavily relied on because it is just a number. And sometimes it can incorrectly deem someone as a certain category without accounting for other parts of their body composition and accounting for their muscle mass and their bone weight. So this is definitely kind of a problematic measure to use. So they suggested using altered BMI thresholds. So lowering the cutoff of the BMI for cardiovascular risk to 23 to 25, and also making sure that they don't wait until a BMI of 30 to alert South Asian Americans of CVD risk and start a little bit lower. Waist circumference and waist to hip ratio were also suggested as much more accurate measures of cardiovascular risk. Imaging techniques like DEXA scan and CTs can help better quantify where fat is located in a person's body. And of course, fat is healthy. So just kind of understanding how it's distributed and understanding what the risks are from that can be helpful. And then finally, hormones like adiponectin and resistin, which are secreted from fat cells, quantifying the levels of those hormones can be useful as well. So it's really important to look at social and behavioral determinants of obesity because it isn't something flat, right? It's measured by so many different things and affected by many different social factors. For example, there could be the stress of migration that comes with migrating to a new country. Religious affiliation can affect alcohol use, dietary practices, and most importantly, the degree of acculturation can affect your dietary practices. And in South Asian populations, this really affected whether it was more of a dairy-based diet, if they affiliated more with their home country versus more of a protein-based diet based on traditional Western diets. And then finally, some lifestyle interventions that have been noted are dietary interventions and physical activity interventions. So dietary-wise, there's been some work to adjust the common South Asian diet to make it less carbohydrate-rich and more rich in proteins, more rich in fiber. So for example, switching from brown rice to white rice, and then kind of adding some almond flour when they make tortillas to make it less carbohydrate-focused. And then physical activity, it's important that when designing physical activity interventions, you're using culturally salient educational techniques. So understanding what current physical activity practices are and trying to adjust that for the South Asian population rather than making overarching programs that aren't targeted towards South Asians. So it's important to look at reducing stress in South Asian groups and also increasing physical activity because that tends to be lower in South Asian populations. Thank you. That's all I have to present, and looking forward to all of your presentations and questions at the end.
Thank you so much. So we are going to hold questions for the end. So we're going to move on to the next presentation now.
All right, just give me 1 second to share my screen. All right, can you all see this okay? Okay, wonderful.
Okay, awesome. Hi, everyone. So my name is Lizbeth Carrazco. Thank you for joining us today. I'm going to be presenting alongside Marjorie Kersten, and we're going to be telling you about our evaluation of Chicago Grows Food, Grow Your Groceries campaign.
So I'm going to start by sharing a little bit about the background and why the program was created. So in Chicago, there are large disparities in food insecurity, as demonstrated by the map on the screen. Rates are disproportionately high on the south and west sides of the city, areas that have larger populations of Black and Latinx individuals. So food insecurity is also a health equity issue. During the COVID-19 pandemic in particular, food insecurity was exacerbated as supply chains were disrupted and individual incomes were altered. Home gardening can improve food security, but there are often barriers to growing food at home, including adequate growing space, knowledge, time, money to set up a growing space, and a system of support. This is where Chicago Grows Food comes in. Chicago Grows Food is a collaborative of organizations, individual local food advocates, and researchers that was formed in March of 2020 to address increasing rates of food insecurity on the south and west sides of Chicago during the COVID-19 pandemic. CGF's flagship program is called Grow Your Groceries. This program provides free home gardening kits that include a fabric grow bag, seeds or a seedling, which is a baby plant, and an educational booklet to help individuals grow their own food. Kits are distributed through our partners at Chicago Public Schools and community organizations. CGF member organizations also provide free educational workshops to grow kit users. So the purpose of the evaluation that we conducted over the summer of 2021 was to evaluate the Grow Your Groceries program. This was the first evaluation that we actually conducted for the program. Specifically, we were interested in determining if the Grow Kit impacted confidence in growing food, healthy food access, healthy food consumption, time spent outdoors, and desire to continue growing food.
So to determine the effectiveness of the campaign, we conducted a participatory post-program evaluation. CGF members who supported the analysis began by designing an evaluation logic model. Next, we recruited 4 Grow Kit users to participate in a focus group to obtain feedback about our evaluation logic model. Based on their feedback, we revised the logic model and created a focus group guide. We hosted 2 focus groups with a total of 6 participants. After the focus group, we created a questionnaire, which we distributed to our listserv of program participants from 2020. Following the completion of the focus groups and collection of 72 survey responses, we began the qualitative analysis. The analysis consisted of reviewing the focus group transcription and finding common themes and patterns in conversation. The working group created a master list of codes And after reviewing and combining the lists, there were 46 parent codes and 10 subcodes that were used to analyze the focus groups and 4 of the survey questions. For the quantitative analysis, we use SPSS and first calculated descriptive statistics, which are reported in the results section. We also calculated chi-square tests for independence and are in the process of conducting a logistic regression.
So for our results, from the questionnaire sample, the median age was 40 years old, and a majority of respondents were female, identified English as their preferred language, and had never grown their own food. 58% of the sample identified as Latinx, and 53% indicated that they resided on the south side of Chicago. From the questionnaire, we were able to identify outcomes from the program. After participating in the program, a majority of respondents reported that they were very confident in growing their own food, that they spent more time outside as a result of participating in the program, that growing their own food helped them eat healthier, and that using the Grow Kit made it easier for them to access fresh fruits, vegetables, and herbs. Finally, respondents indicated that they were likely or very likely to grow their own food again after participating in the program. From the focus groups, the most common codes were community, family involvement, and personal growth. These codes highlight other benefits that individuals realized from the program outside of those that we measured through the questionnaire.
So the results of the program evaluation demonstrate strong evidence of the program's success according to our original objectives. We also learned of individual level benefits through the focus groups, including community, family involvement, and personal growth, which we can try to maximize in the future. Future iterations of the program should consider garden education opportunities to facilitate personal growth, family activities to facilitate family involvement, and community activities to build community. One major limitation of the evaluation was the small sample size, which limits the power of our analysis. However, future iterations of the program evaluation should seek more responses from program participants. And that's all for us.
Thank you so much.
Thank you to our presenters. I'd like to open up the floor for any questions for anyone that's viewing this. You can just go ahead and unmute yourself or put them in the chat.
I had a question for Marjorie and Lizbeth on the Grow Your Own Food program. So I might have missed this before, but what did the education look like to train community members on how to take care of their seedlings and how to nurture them, and what did that kind of look like to make them comfortable in growing their own food?
Yeah, great question. So all of the kits come with an educational booklet. So it's written in both English and Spanish and has links to videos and some additional web resources as well, which are housed on our website. But the booklet really is kind of a core from okay, you have this kit, what do you do with it, to all of the basics. So where do you put it to set it up? How much water do you give it? How do you harvest what you're getting from it? So it really tries to take folks from getting this item from square one if you don't know how to grow a plant at all, to actually taking care of it and then harvesting from it to enjoy what you're growing. So that was our original attempt at education. And then we sprinkled in some workshops that our partners and CGF members regularly have. So a lot of the CGF member organizations already engage in garden education through their work. So they're affiliated with Chicago Public Schools or other community-based organizations. And so they're hosting these workshops, and we're able to invite program participants to join the workshops as well. So of course, they're not mandatory, but we encourage folks to attend so that they can expand their knowledge that way as well. One thing that we didn't report on in this presentation was we did actually ask a question for how folks would want to receive education and what types of education they would like to have. So that's something we're also looking to build out in the future is, how can we better support folks, recognizing that handing them a booklet with some instructions might not be adequate. So I think that's still an area of an improvement and work in progress. But so far it's been, it seems like it's been okay with what we've been able to provide.
Great, thanks for that.
Yeah.
I have a question for Ashwini if there's time. Okay. I'm sorry if I missed it on that last slide where you had recommendations for lifestyle changes and interventions. Can you give an example of culturally relevant physical activity or exercise, what that looks like for this population?
Yeah, definitely. And if there's more time, I would have expanded on that more. I think, so for example, some papers realize that in a lot of South Asian populations, especially middle to elder populations, there's a lot of resistance to going to public gyms. And a lot of people don't want to be, especially some of the more conservative communities, don't want to be told to come to a group workout training session in a public gym. So instead of that, they organized home exercise visits where they basically had like a physical therapist and a personal trainer come to people's homes and teach them like personalized routines. So that was one example that kind of got around some of the cultural stigmas that are there of exercising in public. Also just in terms of like what activities were more regularly done by South Asian Americans. For example, a lot of them enjoy, not to generalize, but what was found is there's a lot more interest in like golfing and brisk walking as compared to doing weightlifting. There's not as much interest in weight training and running on a treadmill, for example. So they tried to organize programs around existing interests, like designing a walking program where people were walking a couple miles a day instead of trying to force them to do a training program that they wouldn't be familiar with and they wouldn't be comfortable with, if that helps.
Thank you.
Mm-hmm.
Thank you for the questions, everyone. I want to invite people to either stay in this breakout room or move between the other two. We're going to start another session and have the presenters present their findings and their abstracts again.
Thank you. That was awesome. Just want to say that.
Thanks for coming, everyone.
Thanks for joining and listening to our presentations.